Let's talk health. NHS England's National Medical Director, Professor Sir Stephen Powis, is to step down from his role and has announced he will finish his duties in July. It comes just a week after Amanda Pritchard, erstwhile Chief Executive of NHS England, abruptly announced she was also quitting after the Health Secretary, Wes Streeting, made it clear he wanted greater oversight of the health service. Health sources have stressed, however, that Stephen Powis had been planning to stand down for several months before Pritchard announced her unexpected and sudden exit. Well, let's talk to Dr. Tony O'Sullivan, a retired consultant paediatrician and co-chair of Keep Our NHS Public. Tony, welcome back to the programme.
Hello again. Hi, Henry.
Hi. What do you think this means? First of all, Pritchard and now Powis.
There's an underlying trend that is being noted that Wes Streeting is centralising power in his department and weakening, in a sense, the decision-making of NHS England. And in one sense, by centralising power in his own department, he's taking back the duty of the Secretary of State for Health to provide comprehensive health services. And this was actually removed in previous legislation under the Conservatives, which created NHS England as the main independent commissioner of health services. And in my view, that was a worry towards commissioning private healthcare more and more, both directly by integrated care boards now, or encouraging NHS hospitals to outsource their waiting list to the
So, Tony, if that shift was alarming, do you welcome this tilt back to ministerial control?
Yeah, well, that's a good question. In principle, it would need legislation to legally restore the duty of the Secretary of State. And I would welcome it if that happened, because it would mean that the Secretary of State was responsible to Parliament and the Parliament was responsible to the population. And that's the way it should be. On the other hand, we have to ask, what is the underlying strategy that he's pursuing that will allow him to use his sort of power grab, if you like. And the criticism of Amanda Pritchard and NHS England managers has been that they've been dragging their feet. I think that the NHS is in such a serious crisis, with very, very serious accumulation of underfunding and fragmentation, that it's completely unreasonable to expect the direction of travel that Wes Streeting is demanding to be put through in the middle of a crisis without serious funding. And what he's doing now is he's putting in Penny Dash as the new chair of NHS England, with his praise for her as a radical reformer. Now, the word reform can be viewed in many ways.
Sound like you feel it's a dirty word.
Well, of course, the NHS has never stopped reforming. You know, I worked for the NHS for 40 years, and I have the deepest respect for the colleagues that I used to work with and that are still there. And you saw their ability to reform the system when COVID broke out. And within a few days, they had completely changed the pathways of care in order to cope with the dreadful pandemic and the threat that was there for the population and for the staff, even though the NHS had been left in a parlous state by the government up to 2020. So I think reform can be, of course, change for good, but if it's a euphemism for driving through rather bullying changes without the funding to allow those changes to occur, if it's saying that we won't fund properly, we won't repair the shortage of beds, we won't repair the falling down ceilings, we won't repair the shortage of GPs, the shortage of consultants and nurses, and we won't repair social care, but we will drive through under the words reform an expectation that productivity will be driven by AI, the use of NHS apps and IT, and the insistence that care will be in the community rather than hospital without the funding of the skilled staff that is needed for that, then that's where the word reform falls apart.
Well, we'll have to wait and see what Wes Streeting does. Thank you very much, Dr. Tony O'Sullivan, a retired consultant paediatrician and co-chair of Keep Our NHS Public.